Influenza has continued to live with us since 1918 to date, and it has gotten to epidemic levels, and now we are in a pandemic, and this has resulted to devastation of economies as well as endangering of species. Basic background of influenza: this is an acute viral disease of poultry. The epidemiology of the disease: it is spread sporadically worldwide, and it has gone to epidemic levels with the highly pathogenic avian influenza, as well as being endemic in countries such as Egypt. There are several drivers of the disease, as movement of human and migration of wild birds, as shown by the East African pathway that involves the migration of wild birds all the way from Asia, coming to East Africa, and spreading to Southern Africa. This has resulted in endangering the species of African penguins that is found along the shores of the Southern African states. Unless we make early detection of this, our efforts will be worthless, hence resulting in a pandemic state of the disease. Right now, we are in a pandemic state. Unless it's controlled, we'll be losing the battle. I'll take you through prevention and control. Surveillance is the first line of defense against influenza, biosecurity, as well as culling and effective disposal of dead wild birds, such as the African penguins, and vaccination. Thank you.
So we have a problem. We had an epidemic that has developed into a pandemic, and the root causes of this problem is there is weak communication channels. We also have inadequate allocation of resources and inadequate knowledge. This in turn has brought about the following. The following effects, where we have loss of biodiversity, we have these birds dying, we have restrained resources, and we are at risk of facing economic crisis. But the big question still remains that from the epidemic to pandemic, the question remains, does this disease spread from animal, from human beings to the birds, or is it a new strain that has been reported in the penguins? The SWOT analysis, our strengths that we identified most were that we have a government support, and also we have a well-developed tourism sector. On our weaknesses, we have poor communication channels, and also lack of knowledge poses a threat to us. On opportunities, we see that the Ministry of Health has come up with training programs that have put in place in order to train both the vets and the human health to deal with this pandemic that we now face. On our stakeholder analysis, we put across different people according to their power and their interest, making in mind that power entails the influence they have and also the resource they have. We have the Ministry of Immigration. This is due to the tourism, the tourists that visit, and they visit different areas to look for these wild birds. The Ministry of Immigration will play a very big role using their resources in order to curb the spread and also to stop the pandemic that is ongoing. But our main aim in analyzing these stakeholders is to bring everyone into one boat, whereby they have the interest and they are willing to use their resources in order to deal with this pandemic. Based on that, we used the One Health approach, the value chain approach. We also used the sustainability approach and the innovation approach to come up with our interventions. Thank you.
So, in order to live in a world that is free from flu, we came up with 3 thematic areas on which our interventions were based. Our first thematic area was mitigation of fear of the disease. and loss of livelihood. Our second thematic area was prevention of disease spread from non-infected persons and poultry. And our third thematic area focused on cross-cutting intervention and infrastructure for the future. So we begin with our interventions to mitigate fear of the disease and loss of livelihood. Now, our interventions or our plan is based on, we came up with various outcomes and activities that will help us achieve the various outcomes. And on that, we also came up with a time frame on whether it is short-term, intermediate term, or long-term. And we also came up with resources and the budget allocated towards the activities that we plan to take on. So in order to mitigate fear of the disease and loss of livelihood, our expected outcome, first of all, would be to achieve a community that is aware of the disease and its impact on livelihoods. What activities do we plan to undertake to achieve this? First of all, we would conduct education campaigns on the disease and its impact. The education would involve signs and symptoms of the disease, ways in which it is transmitted, prevention measures, and proper health-seeking behavior when one has the symptoms. We would also debunk myths regarding the disease. Various myths exist, such as people may tend to think that a flu is just a bad cold, and hence they won't seek proper medical attention as they should. Or rather, people tend to think that a vaccine will make you more prone to the disease, which are all myths, and we tend to debunk them. Our second expected outcome is employment of innovative approaches to reach more communities. First of all, we would do this by developing a mobile application or a website that would help in dissemination of information. And right now, since the disease has reached a pandemic level, this would be key. This would be really key, especially in increasing our scope to other countries so that we would disseminate the information in a more proper way. We would also lobby for public-private partnerships to support communities experiencing culling of poultry through compensation and livelihood recovery. And this would reduce the fear of loss of livelihood. Our third outcome in mitigating fear would be to reduce the impact of the disease on livelihoods and country development. That is the GDP. Our first activity to undertake this would be to diversify sources of GDP by tapping into other sources of other alternatives such as gold and copper mining. We would achieve this by focusing with mining companies and industries related to this. We would also give a press conference on the disease control updates to alleviate fear in investors and tourists. This would also be done by structuring a message, especially to tourists from the islands and tourists coming back to our country, to tell them on signs to look out for and what to do in the case of the risk of the disease. We would also restrict close contact and exploration of wild bird sanctuaries, and would train and support communities to engage in alternative sources of livelihood. This would also be done by engaging cooperative societies and farmer unions. Yes, and how would we trace exposed tourists? Since tourists come from the islands to our country, this would be a key source of fear. And how would we trace them? We would use airline and ticketing systems, automated human screening. This would be mandatory within the islands and once within the airports in our country. We would use immigration border points. We would also follow the transport manifest and park entry manifest. We would also check with hotel bookings, real-time tracking, and the National Integrated Identification Managed System that would integrate all possible identification of one of or any of the citizens from our country or from another country. Yes.
Thank you. Now we all know that prevention is better than cure. And based on that, we came up with activities, and this was one of our outcomes, that we want to have a better response system and information flow within the community. So the first thing we're planning to do is setting up an information desk, and this time we want to integrate it with the international information desks. We also want to develop protocols and work with stakeholders, realizing that this is happening at the marine bases of South Africa. We'd really love to involve environmentalists because of the question of the disposal of the wild birds and maintenance of oceanic health. We'd also love to share the information with partners using already established platforms like the OIE, the WHO, in accordance with the Global Health Security Agenda. Also, we'd love to lobby for setting up joint risk assessment and global coordination team working under FAO. In addition to this, we'd love to leverage on existing platforms. And by this, I mean that the command systems that are within the country, the emergency response system that are within this country, we'd love to leverage on it and lobby that we have an integrated system within the African region bloc as well as a global system. To reduce the risk of spread of disease, we want to protect our risk population. And what exactly is our risk population? Who are they? Considering that we have both wildlife as well as humans. We are considering the children under 14, healthcare providers, military, ports authority, and when it comes to birds specifically, the wild birds and the penguins of South Africa. But our concern as we are doing this, we'd love for you to explore, and this is a call to action, to also explore the possibility of using antivirals in treatment of these avians. Why? Because of the issue of antimicrobial resistance. Another possibility to explore as you're handling this is, does water act as a vector for influenza? We'd love to liaise with conservationists and wild experts to ensure that we are protecting the rare species, especially the penguins of Southern Africa, for instance, and the penguins of Madagascar, as well as the cranes of Uganda. We all know this, which are very special to the continent. We also want to impose movement control and screening of persons, as my colleague had mentioned. Conducting good training is also necessary. To reduce the mortality in both birds as well as the persons, we'd want to work in line with the referral guidelines that have already been, that are already in place. For instance, I mentioned the Global Health Security Agenda as well as the WHO and the FAO. And this will do it by, number one, availing medical supplies, including the antivirals, PPEs, vaccines, diagnostic kits to the areas where we've stratified as our risk areas. We'd also love to distribute information on the case definition, and this we work with union. Remember, this is a problem that is global. This is a problem that is spreading, and at the moment, we are assuming it is a pandemic. We want to manage our patients according to the referral guidelines set in place. And if we can enable an exchange of information, whether through research, the better. Thank you.
Ladies and gentlemen, as you are aware, it's now a pandemic and we have to work together as various groups. So one of the ways to collaborate will be, first of all, we have to map the resources that we have available and then see how we can best utilize them, and also see the countries affected, how many resources do we have, how much resources do we have, and how best do we utilize them. We also have to hold consultative meetings between the governments of the countries affected and international organizations like World Health Organization and other stakeholders to address this problem. We also want to put in place quality infrastructure for the future, and that means strengthening the national disease reporting and information systems and collaborating this information within, not only within the country, but also outside, so that we can best address this problem. We also want to leverage on good political goodwill, so that the good relations that are shared between the countries, we can work together and address this problem. We'll also like to equip the first-line centers, those who deal with the problem at the grassroots, so that they can best address this. We also want to, innovation and sustainability is a very important thing when it comes to coming up with an approach that works. So we are looking at researching into controlling the influenza within the birds and the poultry. We are thinking of promoting environmental friendly approaches and also putting in place legislations that will ensure the funding is guaranteed. As you can see, this is just an illustration of how the system can be like to coordinate the information from various stakeholders and then collaborate with other countries. And this is, for the conservation officer, we would like to work with them by giving them information on how to deal with the dead birds, for instance, protective gear, how to disinfect the environment, how much impact does the epidemic have, so that they can prepare in advance. And also give them support in terms of our research and also the resources we have and the partnerships we already have. Thank you.
Now, in order to achieve all these things, we need to have a budget. We already know that we have $700,000 that has been provided for us. But, however, we decided to work with $2.1 million because this situation at this point is actually big and we have to deal with it. So, we intend to work with partners like WHO, FAO, IOE to be able to get the deficit so that we can be able to work on this project. So we allocated 50% to the prevention of disease and 19% to issues on mitigation of fear. And remember, we have 18% for a contingency, which is a contingency fund, so that because you can see right now it's on pandemic basis, so that we can be able to, we can tap to that to be able to act on these situation. So when it comes to monitoring and evaluation, we intend to do monitoring and evaluation so that we can be able to see that we have achieved the goals that we have. And we will do this on a national level, regional level, and international level, because right now the disease is really spreading fast. We'd like to acknowledge all the people that we worked with on this to come up with this proposal. These are our references. Ladies and gentlemen, merci, thank you, asante.
All right, mine is the appointing of authority was the president. And so what message, one strong message that you give to the president regarding this outbreak?
The message that we'd like to give to our president is that we believe that we will tackle this, that they should give us all the resources that they should give us all they should avail all the resources that they have, and they should be able to talk to the presidents of the other countries so that we can be able to work on this as a region and also as a continent. And also they should consider talking to the international bodies, for example, the East African Community, the African Union, and all those other unions, so that we can tackle this problem, because it's really big now that we can see it's achieving pandemic levels.
Thank you, Team Kenya. One more round of applause for Team Kenya.